Silent threats. Understanding the basics of STIs. Sexually transmitted infections, or STIs, are infections passed from one person to another through sexual contact. Anyone who is sexually active can get an STI. Many STIs don't cause noticeable symptoms, especially in the early stages. This lack of obvious symptoms is why regular testing is crucial. Untreated STIs can have serious long-term consequences for your health. Early detection and treatment are essential for protecting your well-being. Remember, knowledge is power when it comes to sexual health. Understanding the risks and taking preventive measures can help you stay healthy. Chlamydia, a common but treatable infection. Chlamydia is one of the most common STIs, particularly among young people. It's caused by a bacterium called Chlamydia trachomatis. Many people with chlamydia experience no symptoms at all. When symptoms do occur, they can include pain during urination, unusual discharge, and pain in the lower abdomen. Chlamydia is easily treated with antibiotics. However, if left untreated, it can lead to serious complications. Women may develop pelvic inflammatory disease, which can cause infertility. Men can experience epididymitis, an inflammation of the tubes that carry sperm. Gonorrhea, the rising threat of antibiotic resistance. Gonorrhea is another common bacterial STI. Like chlamydia, it often causes no symptoms in the early stages. When symptoms do appear, they can be similar to those of chlamydia. Men may experience burning during urination and penile discharge. Women may have vaginal discharge, pain during intercourse, and bleeding between periods. Gonorrhea is becoming increasingly resistant to antibiotics, making treatment more challenging. Untreated gonorrhea can lead to serious health problems, including PID in women and epididymitis in men. It can also increase the risk of HIV transmission. Syphilis, a complex infection with serious consequences. Syphilis is a bacterial infection that progresses through several stages. The first stage usually involves a painless sore called a chancre. If left untreated, syphilis can advance to later stages. These stages can involve a rash, fever, swollen lymph nodes, and other symptoms. In its late stages, syphilis can damage the heart, brain, and other organs, leading to serious health problems. Syphilis can also be passed from a pregnant woman to her unborn baby, potentially causing birth defects or stillbirth. Section 5. HIV, a life-altering virus with effective treatments. HIV, or human immunodeficiency virus, attacks the body's immune system, specifically targeting CD4 cells, which are crucial for immune defense. If left untreated, HIV can lead to AIDS, or acquired immunodeficiency syndrome, a condition that severely weakens the immune system, making it difficult for the body to fight off infections and certain cancers. HIV is spread through contact with infected bodily fluids such as blood, semen, vaginal fluids, and breast milk. It is important to note that HIV cannot be transmitted through casual contact, such as hugging or sharing food. There is no cure for HIV, but with effective treatment, people with HIV can live long and healthy lives. Modern treatments have transformed HIV from a fatal diagnosis to a manageable chronic condition. Antiretroviral therapy, or ART, can reduce the amount of HIV in the body to very low levels, preventing the progression to AIDS and significantly reducing the risk of transmission to others. Consistent use of ART can help maintain a high quality of life for those living with HIV. Section 6. Long-term health impacts, infertility, chronic pain, and more. Untreated STIs can have devastating long-term consequences for both men and women. These consequences can affect various aspects of health and well-being, often leading to serious medical conditions. One of the most serious complications is infertility, the inability to conceive a child. This can be a heartbreaking and life-altering issue for couples trying to start a family. Pelvic inflammatory disease, or PID, a common consequence of untreated chlamydia and gonorrhea, can damage the fallopian tubes, making it difficult for an egg to reach the uterus. This blockage can prevent fertilization and lead to infertility. Untreated STIs can also cause chronic pelvic pain, a persistent pain in the lower abdomen that can significantly impact quality of life. This pain can be debilitating, affecting daily activities and overall well-being. Some STIs, such as HPV or human papillomavirus, can increase the risk of certain types of cancer, including cervical cancer. Regular screenings and early detection are crucial in managing these risks. HPV is a common STI that can cause genital warts and other health problems. Vaccination and safe practices can help prevent the spread of HPV and reduce the risk of associated health issues. Section 7. Prevention is key safe sex practices and regular testing. The good news is that STIs are preventable. By taking proactive steps, you can significantly reduce your risk of contracting or spreading these infections. Practicing safe sex is the most effective way to protect yourself. This means being informed and making conscious decisions about your sexual health. This includes using condoms consistently and correctly every time you have sex. Condoms act as a barrier, preventing the exchange of bodily fluids that can transmit infections. Limiting your number of sexual partners can also reduce your risk. The fewer partners you have, the lower your chances of encountering an STI. Regular STI testing is essential for anyone who is sexually active. Testing helps you stay informed about your health status. Testing allows you to know your status and get treatment if needed, preventing the spread of infection and potential long-term health problems. Early detection is key to effective treatment. Talk to your healthcare provider about how often you should be tested based on your individual risk factors. They can provide personalized advice to ensure you stay healthy and informed. Section 8. Seeking help, treatment options, and resources. If you think you may have an STI, it's important to see a healthcare professional right away. Don't be afraid or embarrassed to seek help. STIs are common, and healthcare providers are trained to provide confidential and non-judgmental care. Treatment for most STIs is readily available and highly effective, especially when started early. Antibiotics can cure many bacterial STIs, while antiviral medications can manage viral infections like HIV and herpes. Remember, early detection and treatment are crucial for protecting your health and the health of your partners. Thanks for watching.